Well, hello, everybody, and welcome back to News for the Bronx. Back to that big news in the effort to stop the spread now. Kids can now begin to receive their COVID vaccines.
That's right. We've got a very special guest who's joining us this morning, the city's health commissioner, Dr. Dave Chokski. Good morning to you, Dr. Chokski, and thank you so much for being here with us.
Good morning to you both. Thanks for having me.
Yes, we appreciate you being here. We want to get right into it. So according to the CDC, in the summer months, there was about a 6-week period where there was a high COVID hospitalization among children. So why is the authorization of this vaccine right now so important in turning the page during this pandemic?
Thanks. This is such an important question. And what we saw in the science that was presented before the CDC and the FDA is that the vaccine for 5 to 11-year-olds, it works. And it's so important for the reason that you pointed out, which is that we've seen cases and hospitalizations and unfortunately even some deaths among the age group that is now authorized to get the vaccine. We now have a way to prevent that. And so I'm just delighted that we're going to be able to move forward with that in New York City.
So Dr. Chokski, of course, the message has and continues to be from the city that this vaccine is safe and effective. But understandably, there are some parents who are hesitant to take this major step and get their 5 to 11-year-olds vaccinated. So first, I'd like to ask you, can you give us any insight as far as clinical trials went? Were there any adverse effects reported in this age group? And secondly, is there a message that you can give to parents to sort of ease their concerns in terms of long-term effects of this vaccine?
Thanks. And I'll start by saying that I understand, the reason for caution, not just as a doctor, but as a father myself. You will go to every single length to ensure that your child is safe. But the good news is that these vaccines are now extremely well studied, including in the age range, 5 to 11-year-olds, that was just authorized. And what we've seen from the clinical trials is that they're very well tolerated. There were essentially no serious adverse events in the clinical trial that was conducted. And most of the side effects are what we've seen with the COVID-19 vaccine in other age groups. Some arm pain, some fatigue, some fever, some headache, and those generally abate within 1 to 2 days.
Definitely.
For the more severe side effects, what I would say is that the benefits strongly outweigh any risks. And just look at what I think of as the foremost experts on this. Pediatricians who are parents themselves, they're making the strongest recommendation for this vaccine.
Definitely important for our parents to hear that. And schools will be hosting pop-up clinics, vaccinations for kids starting next week, about 200 schools a day. How important do you think that is to have it readily available for parents and for them to talk to health officials about what is going in their children's arms?
Yes, well, I'm really excited about this. We have a partnership with our Department of Education, and we're going to stand up those vaccine clinics next week, as you mentioned. For some families, for some parents, that will be the most convenient way to get their child vaccinated. So it's a great option. But we're going to have a no wrong door approach. Pediatrician offices, family doctors, pharmacies, and our own city sites. And so whatever is most convenient for a given family, go to nyc.gov/vaccine finder, and you'll be able to navigate your way to the most convenient appointment for you.
All right, the city's top doctor, Health Commissioner Dr. Dave Chokski, thank you so much for being with us and also leading us through this pandemic here. And good to see that Dr. Easterling's giving you a break with some of those PSAs now.
Thanks so much. I appreciate the time, and we'll keep getting the message out.
All right, perfect. Have a great day. Thank you.
Take care, doctor.